You don't get rid of negative reviews. That's the conundrum here. Everybody that gets a negative review is like, how do I get rid of it? Even if it's fraudulent, they're thinking, how do I get rid of it? Let's just say for this particular example that you have a negative review. It's actually a real patient of yours. They didn't have a good experience. You don't get rid of it. What you do is you respond to it, and you respond to it in a hyper professional manner, and you try and take the conversation offline. So you would say, Sean, I am so sorry about your experience. That is not who we are. That's not what we stand for. I would like to speak with you personally. Please give me a call whenever you can. End it. You respond to the negative reviews and you keep it, because that negative review actually shows patients how you handle bad experiences. And that's what people are looking for when they're looking at your review profile. They want to see a lot of good ones, but they also want to see, how did they respond to that particular bad review? Did they respond to it? If I'm a patient and I'm investigating you as a dentist and you have 500 reviews and there's 5 bad ones, and you've responded to everybody on there except for the bad ones, then I know that if I have a bad experience, you don't want to talk to me. That's not good. You want to use this as an opportunity to show patients how you handle difficult situations. The best thing to do is not try and remove it, but you get 100 new good reviews on top of it. That's the best thing to do. You do not want to shoot for a 5-star average rating. You want to shoot for a 4.8, 4.9 average star rating. Research shows that a 5-star rating is actually seen as being slightly deceptive. When you see a 5-star rating and they've got 500 reviews, you're like, how did that happen? That doesn't seem real, right? But if it's 4.9, you're like, oh, they've got a really, really good star rating and they've handled their negative experiences properly. You don't want it to be perfect. You want it to be almost perfect. Okay. Now, on top of that, I will say this. If a review comes in and it's not an actual patient of yours, somebody's spamming you, somebody, who knows, they're not actually a patient. You can just send that review, send it to Google, and they will verify it. And if it can be verified that it's not correct, they'll just remove it. That's a really simple process. You just flag it, send the message to Google, and they'll just remove it. It happens all the time. So that's how you handle a review that's a legitimate negative review that's your patient, and a review that's not legitimate. It's from some source that who knows who it is.